we are using. So this is the also you can give. This is the daily, so that's why in the previously, that is the morning and evening, the 2 times there is the lighting the lamp and doing this dhupana karma. And even now we are using this phenyl and all these chemicals for the disinfection, but our nimba patra, that is in Ayurveda, it has been mentioned in the pediatric care, that is Krida Bhumi for the children's, that it should be disinfected by the nimba decoction of the nimba. So in that we can use in this pandemic condition. Why we can't use? We can use and further free from the infection.
Yes, certainly, madam. We will try to employ all those measures which you had told, and hope Srimati ma'am also heard all these non-pharmacological methods which Ayurveda
I
has
think
advocated.
which we can use it in daily life, ghee and honey. Yes,
Yes, ma'am.
Isn't it not? Yes, thank you,
Yes.
ma'am. Yeah.
Yes, thanks. So let's go to the next question to Dr. Srimati madam. This question is from Dr. Dharitri Purohit. So Dr. Dharitri Purohit is asking, ma'am, pregnancy is a state of immune suppression. In such condition, is there any role of immunoglobulins in the period of preconception or pregnancy for previously immune compromised women, especially during such pandemic or epidemic situations?
Right. One thing which I would want to say is, we have always thought as pregnancy as an immunosuppressed state, but now what we are going more and more and saying is it's a relative immunosuppression. More than immunosuppression, it is an immunomodulated state wherein the balance is altered towards being an anti-inflammatory state. So it's mainly a balance which is very, very important. So that is why even when we were discussing in our presentation, some autoimmune diseases are better during pregnancy, whereas some get aggravated in pregnancy. Because if you say it is immunosuppression, then all your autoimmune diseases shouldn't, sort of flare up in pregnancy, which is not the case. So it is a case of immunomodulation and the balance between the pro-inflammatory and the anti-inflammatory, which matters. Now, coming into this question about IV immunoglobulin, I think I would want to see it in two things. One is in immunocompromised and other one is non-immunocompromised. Immunocompromised patients you mean that they have some primary immunodeficiency or they have some background problems with immunity. If that is the case, they would already be in a plan as to how they are going to get medications, so that we would be continuing. But usually that is very rare, seeing such women going on to pregnancy and sort of continuing all these things. So, but if that is the case, if she's got a combined immunodeficiency, if she's suffering from such problems, if that is the case, they would be carrying on with whatever medications they have been before. Okay. Whereas if it's a non-immunocompromised, non-immunodeficient women, the role of IVIG. The IVIG has very specific indications when you're going to be using. If it is an infection, then, sort of more than IVIG, it is a specific immunoglobulin, because IVIG generally would not have a remarkable effect on all infections. In sepsis, they say if it's a florid sepsis, if it's not getting better, you might want to try IVIG. Otherwise, you use what is called as an hyperimmunoglobulin. That we use it common in hepatitis B. Hepatitis B hyperimmunoglobulin, or you have tetanus immunoglobulin, you have varicella zoster immunoglobulin. So there are very specific indications for using them. Okay. Now, with regards to IVIG, now there have been lots of studies looking at using it in the preconceptional period in women with recurrent infertility or with recurrent implantation failure, recurrent miscarriages. But unfortunately, there is not much evidence to support its use. Rather, there are more side effects, adverse effects, and problems. So IVIG, though it is being used by many, sort of professionals, it is not generally recommended, and the evidence for its usage, application in clinical practice is very, very less in the preconception period. What about pregnancy? In pregnancy, yes, there are a few indications. Say, for example, if the woman has got an immune thrombocytopenia. In such conditions, like how you use it outside pregnancy, it can be used to improve the platelet level. If somebody has got a Guillain-Barré syndrome, wherein they have a demyelinating polyneuritis, probably because of an infection of various reasons, then we use IVIG if your steroids are not helping. So there are very specific indications for using IVIG. Unfortunately, it is being, sort of used as a magic pill or a magic cure, which is not so. It has got no role in helping the outcomes, the preconception period for non-select women, and also in pregnancy, there are very specific indications for its usage. I hope that answers that question.
Yes, ma'am. So we'll take up the next question also with you. So this question is apart, from the COVID times, we'll go into few of your obstetric clinical experiences also. And when you see such cases, what is your experience or your view on that? Like, there's a question by Dr. Shivani Chaturvedi. It is, if a female conceives at the age of 40, does she have more chances to develop autoimmune disorders?
See, conceiving at the age of 40, so especially a spontaneous conception at the age of 40, I would be very impressed if she's been able to conceive, because there is a high risk of infertility. As we know, the chance of, the AMH, all your follicular, sort of FSH being high, your follicular maturation, everything is going to be affected. So her conceiving itself is going to be very difficult, spontaneous conception, I mean. And even if she's going to have an IVF, the outcome is going to be poor. She might have to have an egg donor. But even let's leave it. If she's going to have a spontaneous conception at the age of 40, I mean, we do have few women coming with spontaneous conception. See, the instance of autoimmune diseases, especially a few autoimmune diseases which we are worried about in pregnancy, like SLE, they are like sort of a bimodal thing. So usually they are very common in the reproductive age group, and later on they go into the postmenopausal age group. So as such, just being 40 is not going to make up predisposed to develop autoimmune diseases. Okay, so I wouldn't be worried about her developing a de novo autoimmune disease. She might have had a pre-existing autoimmune disease with age, because if she's had an SLE, it would have already affected the kidney, so that would worsen with age. Or she might develop diabetes, she might develop other metabolic problems. I would be more worried about advanced maternal age, yes, but not because of its increased incidence of autoimmune diseases, but because of other metabolic problems. I think you understand the difference, isn't it?
Exactly. Yes, ma'am. Yeah. So now let's come to the last part. That is few more questions. Last one or two questions we'll take.
Like a rapid fire, is it?
No, not rapid fire. It is, you could take that. So we'll plan for a rapid fire next time, madam.
Oh, did I give you an idea then?
Yes, because you were so rapidly telling. So next idea, Dr. Srimati Raman with a rapid fire. Yeah. Now, even in fact, Ayurveda has also spoken a lot of concepts about immunity preconceptionally also. The next question is to Dr. Lakshmi Priya, madam, in this regard. Madam, this question is by Dr. Jyoti again. How Pumsavana Samskara can boost immunity? There is actually a misnomer of this Pumsavana always. So I guess madam will highlight more about this. Madam, could you brief out about the Pumsavana Samskara and in the role in immunity boosting?
Okay. So really now the Pumsavana Samskara, due to the PNDT Act, I think it has been stopped in all the institutes in India, I think, for the fear of this PNDT Act. But really, Pumsavana Samskara and the PNDT Act, it is a misconcept, I think. It has been just like a pressure given to the Ayurvedic gynecologist that don't do the Pumsavana. Pumsavana meaning is that is the Putrischa Putrascha Putro. That Kumarischa Kumarascha Kumaro. So that is the Kumara Purnima, not Kumari Purnima. The Sarat Purnima, it is the celebrate as the Kumara Purnima. It is not for Kumara. It is for Kumari. You see, that is the all the Kumaris. So Kumarischa Kumarascha Kumaro. So like this, so it has been mentioned that is this is the Pumsavana. So Pum means like this. That is the not for the Purusa or the male fetus. It is not been mentioned. It has been mentioned that is the Putrischa Putrascha Putro, like this. So Pumsavana Sanskara, that is the Sanskara for the coming the future baby. It is the Pumsavana. How can we will get a best sided qualitative child? So that is the Pumsavana Sanskara. That is not the Sanskara. Sanskara means the Gunantara Dama. That means how we can change the quality. Guna means the quality. So how the process or the procedures or we can conduct, so we can change the quality of the baby. If it is a lower quality, how we can increase into better quality. So that is main the aim, which we have been misinterpreted by the others, that it is only for the male baby. It is not only for the male baby or the female baby. It is the sanskara, like the garbha sanskara. So it is the punsavana sanskara. And the Susruta has been mentioned, that is it has in 3 phases. That is the pre-conception, and during the conception, and after the conception. So in the pre-conception, what we are advising, that in this case, that is the preparatory phase of the parents or the couples, that how to make, that is the you see, for the your plantation, you are taking the best seeds, but for the human being, when you are planning, so can you purchase the best seed? Only to go the IVP center and IVF center and to collect this is the frozen embryo? Not like that. So for that purpose, in the preconceptional care, for the this is the Virechan karma or the Sodhan therapy or the Panchakarma, both the couples should be done. Because Birja Karmukatva Bhavati. Virechana is giving the Birja Karmukatva. That means the potentiality. Potentiality, it has been increased by the Virechan karma. So your this endocrine and metabolism, it has been normalized. If there is any abnormality, that is the Bamana, Virechana, Basti, and even giving the Rasayan therapy also. That is the immunobooster to the both. So for the male, there is the diet and the drugs are separate. By the giving for the which will be, that is the spermatogenesis, and a sperm will be healthy, and that is the best sperm. And for the female, it will be ovulation modulator, and the induction of the ovulation, and guess the best ovum, that is the Artavavardhaka, it is the Sukravardhaka. There is no that much changes in the male and female. Only as per Ayurveda, that is the female is Usna Snigdha. So oil is best for the female, and there is the male is the Sita Snigdha. So that's why the Ghuta or the ghee preparation is mainly giving to the male for the Sukravardhaka, and for the female, oil is the best, that is giving the Mastya, Tila, Kulatha, Masa, all the drugs which are being mentioned, that is should be given. And the Rutukalacharya, Rajakalacharya, during the menstrual period, what is the codes and the conduct are being mentioned, it should be maintained. And in Rutukalacharya, that is the ovulatory period, that is the physically, mentally, and spiritually should be prepared the both the persons with total abstinence. Only they have to allow for the copulation during the ovulatory period. And some havan or the yagna karma and prayers, though they have to do for the psychological, that is the preparation. So the physically, psychologically, and the spiritually, that is the prayers, and to invite a noble soul for their baby. So that is the heaven karma and the yagya. So it is with mandatory, that is the preconception. And the during conception, so during the copulation, there is been mentioned that what is the diet should be taken, and what is the time to be copulation, and what should be the bed should be comfortable, and what is the color of the bed sheet, and what is the fragrance, that is the this natural, that is the fragrance with these flowers, which will be the, it will be inhaled, and it will be the stimulate our just the hypothalamo pituitary ovarian axis, that is the proper the hormonal secretion, and for the conception also. So
yes, ma'am.
And
Yeah.
after the copulation, after conception, then again the this Punsavan therapy is mentioned to continue the pregnancy. That is the for the garbhasthapana.
Yes,
So
yes.
Soumyanasya garbhasthapanana.
Yeah. So actually, so you dealt that the Pumsavana is not only for the PNDT or that sex determination. It has other, that is preconceptionally how we can give a good praja to the society, how we can mold the immunity within. So this was highlighted by you.
For the best progeny.
Yes, 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 ma'am. So probably we've crossed the time which was there. So
Okay, okay,
let's
no
conclude.
problem. No
Yeah,
problem, no problem.
yeah, we had so many questions and we could select only those. And I guess Dr. Srimati ma'am and Dr. Lakshmi Priya ma'am both have shared their views and clinical experiences in this regard of immunity, the role of immunity in OBG. And I thank you so much, both of you, madam, for sharing your views and clinical experiences. Thanks from the, within the heart. And yeah, and I request our Himalaya Drug Company product manager, Dr. Wahid, to please come on the screen now. Dr. Wahid, sir.
Good evening, all. Am I audible there?
Yes, you're audible, doctor.
Good evening, viewers. Once we've had a fabulous time out here. We have come to the end of our third talk in the webinar series Eve Care. Needless to say, it's not an easy task to talk about immunity. More than concern about OBG care, it becomes a more daunting task. But I must congratulate both of our speakers for having thrown very, very important issues that surround immunity in OBG care. Needless to say, our viewers would have definitely enjoyed this particular feast of information that they've got now. Talking about immunity is definitely touching a Pandora's box, not an easy task. And when we talk about it in terms of Ayurveda, a lot of concepts are thrown open, right from Ojas to Rasayana to the concept of Ama, so on and so forth. I'm sure it's always a mix of these and many other concepts that brings about understanding of immunity, be it in general or be it in OBG care as well, which was very much elucidated in both the talks. Today, since we are talking about OBG care, I'd like to take this opportunity to bring forth to all our viewers one of our products that goes by the name ImmuSante, a broad immunotherapeutic support. Himalaya has had a history of bringing out products which are very much in need of the hour. This was a result of the extensive research done across. And since we're talking about OBG care, a lot of herbs come into our mind when we looking for OBG care. One of them is Lodra, and Lodra forms a very important constituent of the product ImmuSante. The other very important component is Shanta, which is Himalaya's find, if I may put it like that, which together make the composition of ImmuSante. I would not be getting into the details of this particular product for time constraints, but however, I'd like to put across that it has got a action proven by our in vitro, in vivo, ex vivo experimental models out there. These are a few of the studies that have been done across. I would not be once again going into them. Due apologies for time constraints. If I may summarize what you can expect when you recommend ImmuSante to your patients, these are a few of them. First and foremost, it's a non-specific immunomodulatory mechanism that it provides, modulating both humoral immunity and cell-mediated immunity. We do remember Dr. Srimati Raman pointing out exclusively to Th1 and Th2 immune responses. We do, this particular product can modulate both of these immune responses. It upregulates the production of interferon gamma and interleukin-4, a very important component when you're talking about immunity, especially concern of a few of the topics that have been put across in our pre-release video as well as in the discussions today. Needless to say, cytokine gene expression and inflammatory cascades need to be understood and modulated out here, which are very, very relevant to immunomodulation. The product is pretty much capable of this activity as well. Last but not the least, it also significantly enhances the function of neutrophils macrophages, and natural killer cells, leading to better phagocytosis and elimination of foreign substances or cells. Well, I am not the authority to put across its exclusive role in OBG care out here today, but yes, our research has proven that Immunosante can be a very, very important product that can be explored in prophylaxis of varied viral infections, ranging from influenza, dengue, chikungunya, herpes zoster, herpes simplex, as well as viral gastroenteritis. Last but not the least, a very, very important concern are opportunistic infections, which raise their ugly heads here and there. We have done some studies which have confirmed that Immunosante can be very, very useful when you're addressing about diabetic foot ulcer, recurrent UTIs, very particular to OBG care once again, oral candidiasis, opportunistic infections in cancer patients like the port infection. We do have some very interesting studies which have pointed that Immunosante could be a product that can be put across to use in neutropenia seen in chemotherapy and radiotherapy. Also as an adjunct in chronic debilitating conditions like TB and HIV. Last but not the least, also on patients who need immunomodulation who are on DMARDs. Now, how much do I recommend this? Based on our studies, we recommend 2 tablets twice a day. With that, I'd like to conclude this particular talk of mine with a verse from Charaka, which says, Matra kala shraya yuktihi siddhya yukti pratishthitam tishtatyopuri yuktigno dravya jnanavatam sada. Translated, it means it is just not important to have the understanding of the dosage or the time, etc. But it is also very important to apply intellect. A physician with the right intellect at the right time can provide the best of the outcomes for the patients. With that, I'd like to take this opportunity on behalf of Himalaya Drug Company to thank both our speakers, Dr. Srimati ma'am and Dr. Lakshmi ma'am, for having spared their very valuable time and given us their insights into varied questions. Very important questions were answered today. We did have a deep insight, deep dive also into some of them. So any amount of gratitude is insufficient to both of you, Dr. Lakshmi ma'am and Dr. Srimati ma'am. Once again, a heartfelt thank you on behalf of the corporate and myself, Dr. Wahid here. Thank you so much, Dr. Shreyas, for helping us coordinate this. I'd like to request you to please take over the session now. Thank you, Shreyas.
Thank you so much, Dr. Wahid. Yeah, so let's conclude the session. So thank you, Dr. Srimati ma'am and Dr. Lakshmi ma'am again. And dear viewers, we would be seeing you live next week with another topic where we will be sharing the views of both the sciences. So that will be the most common clinical presentation which we find in our OPDs now. So that is PCOS, and we have 2 experts to share their views and experiences on PCOS and how integration could help in addressing this PCOS. So we have Dr. Aruna Muralidhar, who would be highlighting about the modern concepts, and we have Dr. Wahida from Kerala, who would be highlighting about the Ayurvedic concepts. So see you all next week. Till then, stay safe, stay happy. Goodbye. Good night.
Thank you.